Hello, my name is Parveen Kumar, and I have the privilege of chairing the Board of Science. I would like to present our annual report for the ARM 2020. The Board of Science has remained a consistent voice for positive change, working together with the Science and Public Health Policy team to address key population health challenges. Board members are continuously involved in reviewing written evidence to select committees and to the all-party parliamentary group inquiries and consultations. These include topics as varied as restricting the advertising and promotion of unhealthy food and drink to climate change. Members have acted as ambassadors for the committee and the wider BMA when attending parliamentary events, meetings with ministers and key parliamentarians to convey the BMA policy messages such as on alcohol, tobacco, obesity, and air pollution. We've also worked to develop our relationships with external stakeholders, particularly with the British Dental Association and its Health and Science Committee. We're most grateful for the outstanding support we've received during the session from the Science and Public Health Policy teams. With the support of the Policy Unit, we followed through with the topics that you wanted us to investigate further at the last ARM. These have included supporting a healthy childhood, supporting prevention, climate change, vaccination, antimicrobial resistance, and mental health. The past year has seen the BMA taking an instrumental role in a number of improvements to public health and equality within our health service, and in particular supporting our members during the pandemic. So to go into some of these in more detail, children and young people have been a long-standing focus of the Board of Science. In February, we supported the publication of a new briefing on supporting a healthy childhood, which followed on from a discussion event hosted by the board in May 2019. This report contained, firstly, an analysis and findings of spending on children's social care in 2019 and 20, recommendation for a cross-government healthy childhood strategy, a recommendation to reverse budget cuts to children's services in England. Health inequalities have been thrown into sharp focus during the COVID-19 crisis, and it is an area in which we will be developing future work with a view to making practical recommendations to the government. Supporting prevention, in the light of the government's Green Paper on prevention, we convened a roundtable discussion event with the Public Health Medicine Committee. We brought together professionals working in and representing the medical and healthcare sectors. We heard presentations from the BMA on our ongoing work on prevention and also from representatives of the Department of Health and Social Care. We discussed shared priorities for preventing ill health. Attendees discussed the current state of the public health, shared priorities in the Green Paper, the key issues and measures that were not included in the Green Paper, and the areas that should be prioritized in the White Paper. We also fed into the BMA's response to this Green Paper consultation, and here the key messages included, firstly, the important role the workforce will play in delivering the ambitions of the Green Paper. It is vital that this is a constant thread that runs throughout the White Paper. We also recognize that the technology has a role to play in preventing ill health, but we do not believe that this should come at the expense of ambitious and wide-ranging population measures, which are focused on the four key areas: ambitious regulation, increased and sustained funding for prevention, a cross-government approach to tackling the social determinants of health, and lastly, prioritizing prevention through the NHS. Physical activity, we're also involved in developing the BMA's briefing on steps to increase physical activity in the UK. Going on now to alcohol, we wrote to the government calling for an alcohol strategy and fed into the BMA's response to the UK Commission on Alcohol Harm. We continue to monitor this area very closely. Obesity, again, another pandemic that's hitting us all. We are active members of the Obesity Health Alliance, which continues to lobby on the relevant issues during the COVID outbreak across its 10 key policy areas. Just recently, it has produced a briefing on how COVID-19 measures are affecting the food environment. We welcome the government's recent announcement of the obesity strategy. Tobacco, we're also members of the Smoke-Free Action Coalition and endorse their roadmap to a smoke-free 2030. Moving on to climate change and air pollution, a major problem, a massive issue at the moment. At last year's ARM, you asked us to plan, campaign, and cooperate to deliver carbon neutrality by 2030. We've been working with the UK Health Alliance on climate change on campaigning around net zero. We had an event planned, but sadly, this had to be postponed due to the pandemic. However, we continue to look for opportunities to push this. The board also fed into a paper which analyzes the NHS Trust and Health Board sustainability. This paper makes recommendation as to how the governments, both the UK and the devolved nations, and trusts and health boards can make the NHS a greener and less carbon-intensive system. This will be published soon. We've also contributed to several inquiries on air pollution and the Environment Bill. Over the coming session, we will be monitoring the potential green recovery following on from COVID-19. Vaccination. We've consistently highlighted the importance of immunization for improving population health. Our members have powerfully made the case for extending vaccination programs across the UK to maximize the health benefits to the population. In recent years, we've become increasingly concerned about declining vaccination cover rates in some areas of the UK and the potential impact this might have on the health outcomes. As our health services moves out of the immediate response to COVID-19 and begins restarting routine and other programs, it is vital that the immunization programs are restarted to their pre-pandemic level, and actions are also taken in a number of areas to increase the uptake in the long term. We've been inputting into a paper which sets out the BMA view on what action the government needs to take to improve vaccination coverage rates across the UK, framed again within the COVID-19 context, and focuses on routine immunization programs. And the government has also promised to bring forward a vaccine strategy due to the pandemic. Antimicrobial resistance is another huge problem. We continue to monitor and lobby the government on its 5-year action plan for tackling antimicrobial resistance. This started last year in 2019 and goes on to 2024. It is, however, accompanied by a 20-year vision. The 5-year plan advocates an approach to tackling AMR that focuses on the following 3 areas. Firstly, reducing the need for the exposure to antimicrobials. Secondly, optimizing their use. And thirdly, investing in innovation. In the light of the COVID-19, it is essential for us to take action on AMR before we reach a crisis point. Mental health, another huge issue. The board has also fed into the BMA's recently published paper on the impact of COVID-19 on mental health in England. This report analyzes the potential effects of COVID-19 pandemic on population mental health and mental health services. It also sets out recommendations for improving these mental health services to ensure they can respond to the mental health needs of the population as a whole. Our key asks here are, firstly, action from government to properly fund and equip services for the anticipated increase in demand and to make access easier for anyone who needs it, and also preventative measures to be better prioritized to look after mental health of the public and health workforce alike. So it has been a busy year and there is a lot more to do. Going on to what we have in the Victor Horsley Scientific Lectures, again, 3 excellent speakers. This year we have organized for the Victor Horsley Scientific Lectures to take place virtually, as the ARM has been done as well. These will include a live presentation from the speaker, followed by a live question and answer session. These lectures will also be recorded for you to access if you're unable to make these times, and of course CPD will also be available. Just to give you a brief insight into our speakers, on September the 16th at lunchtime, we have Problem Gambling to be given by Dr. Henrietta Bowden-Jones. Etta in 2008 founded and became the director of the National Problem Gambling Clinic, the first center to treat gambling disorders. Again on the 16th, but in the evening between 6 and 7:30, we will be talking about the gut microbiome. As you know, the gut microbiome controls just about everything we do, or so the experts tell us. Professor Fergus Shanahan is a world expert on the gut microbiome. He's the professor and chairman of the Department of Medicine and also director of the Alimentary Pharmabiotic Centre at the University College in Cork. Then our last speaker on September the 17th, again at lunchtime, is Professor David Heyman on controlling pandemics. You will have seen Professor Heyman on the television and on radio talking about the pandemic during the crisis. Professor Heyman is a professor at the London School of Hygiene and Tropical Medicine. Before this, he was with the World Health Organization and their Assistant Director General for Health Security and Environment. He also represented the Director General for the polio eradication and has got much experience on pandemics and what they do. So information on how to register for these events can be found on the BMA website on the ARM 2020 hub. So the year ahead, in addition to the motions we will be receiving from this year's ARM, the projects that we will be focusing on over the coming year will include health inequalities, monitoring the COVID recovery phase, continuing our ongoing work to support prevention, and of course we'll continue our work on climate change and air pollution. We also, of course, await suggestions raised by members at the ARM and look forward to the discussions. Just a quick notice, ARM elections, the Board of Science is holding an election for one member for a 3-year term. Nominations are open until 10 a.m. on Tuesday, the 15th of September, 2020, and all BMA members in the UK are welcome to stand. Results will be announced on our website on Friday, 18th of September, and of course the candidates will be emailed directly. So lastly, a massive thank you to a lot of people who've been involved with the work of the board. Firstly, I'd like to thank our board members for their amazing contribution at any time. Our Vice Chairman, Jess Bamra, and then you can read the names of the super people who've been working with us, and also Jacqueline Adams, who is our patient liaison representative. All have given their time unstintedly. Likewise, the Board of Science Secretariat, we just could not have done without them. Hope Mears leads an excellent team with Anne-Marie and Winifred. Hope has been constantly on the phone, looking out for what the board needs to respond to, and of course, an amazing help to our work on a daily basis. The media team, run by Helen, Amy, Abby, Steve, Chris, Denise, and Bruce, all work all days of the night and day, and in the weekends as well, and I'm grateful for their input. The Science and Public Health Policy team, who I mentioned earlier, Robert Wilson, Lawrence, Olivia, and Nathan. Really, without their help, we could have done absolutely nothing, but they are wonderful in giving us really good briefings on the work that is on the table. And lastly, the conference unit with Jane Lewis and Caroline Eason. They're just amazing. They never say no. They're always extremely helpful, and I just don't know how they do it, but there's always a can-do attitude in that department. So thank you all very much indeed for all that you've done. And I hope we will continue to represent you in the next year. Thank you very much for listening to me.